Good day and welcome to another program of On Call. Thank you so much for joining us and for being a part of our family right here at the Tobago Inspirational Network. And we are going to take a little shift from our regular programming, as in the regular topic that we've been doing for the past 3 or so weeks, to look at something a bit different. Before I get into that, let me take some time to welcome our resident doctor, Dr. Maxwell. Dr. Max,
thanks for welcoming me. Thank you.
Not a problem. And of course, as a man with a very busy schedule, we would like to utilize all the time he has as quickly as possible before he has to run off to his next engagement. Right, so today's topic, we're going to be looking at something that affects many people. From the time you cross a certain threshold in life, well, that used to be the past. Now I think it has actually, the age has actually gone down a bit. But what we're talking about today is arthritis. We're going to look at arthritis, how it affects people, who gets it, why do we get it, that sort of thing. So let me get right into my questioning. Dr. Max, but before I even get, how are you today? You good?
I'm good.
All right. I know you're busy, so I wouldn't even ask you if you're relaxed. Because you don't look relaxed. You look tense.
Don't worry. No, I'm relaxed. Just busy, but I'm okay, you know.
All right. Well, that's good. All right. So let's tell the people a little bit about arthritis and so on. So let's start by, first of all, explaining to them what exactly arthritis is. Okay.
From the word arthritis, because normally when I teach this kind of thing, I always want you to break down the words so that you can understand it better. Okay, arthritis is from the word arthro and itis. Arthro means basically joint, and itis means inflammation. So when you combine the two words together, you get arthritis, and it just means joint inflammation. Okay. And when you have inflammation, then you're going to have the symptoms of inflammation, which may include pain, swelling, okay, discomfort, especially when you are moving, okay, restriction of mobility and stuff like that. You could have warmth and redness in some instances, okay, but basically that is what arthritis means. Simply defined as an inflammation of the joint.
Joint inflammation.
Yeah.
Who is prone to joint inflammation? Who?
Practically anybody could get arthritis, really, basically depending on the type, because there are different types and there are different causes. Okay, there's some that are common in certain age groups, okay, depending on the cause, like I said. Okay, so it's not that any particular group of persons are exempted from getting arthritis. Depending on your genetic makeup, on your diet and your age and stuff like that, you may be confronted with different types of arthritis.
But what are primarily some of the main causes of arthritis? Let me digress a little bit. I'm wondering now if maybe that would have been arthritis. But I remember years ago as a little girl growing up, my grandmother always used to tell me, my great grandmother, don't mix hot and cold. So if you're in the oven, you know, you stay away from the sink and that kind of thing until your body temperature, because if not, then you're prone to get pain in your joints when you're older. That's what she said to me. So now, I mean, because I know then they would complain, you know, but I don't think at that point, as I said, that was my great grandmother, I don't think she would have ever said it was arthritis. It was just considered a pain in the knee that making it difficult to stand and bend, and you have to put ointments and creams, or pain in, you feel it in the elbow or sometimes the knuckles, or, you know, nothing. It sounds so much like arthritis.
That's like old wife fable, really. I mean, although, I mean, as you grow older, and you are prone to arthritis, especially the one that is due to aging, which we call osteoarthritis, okay, some of those changes in environmental factors and temperature changes and stuff like that may affect the onset and the severity of the pain, okay, and that's a different mechanism that we may go into later, but that is not always the case in every types of arthritis. So if we go into the different types of arthritis, then I may be able to explain it a little better. Now, the commonest causes, I mean the commonest type really that is most rampant is the osteoarthritis. So that's the #1 type. that affects a lot of people. And usually that is as a result of, you know, an aging process, degeneration in the joint, a lot of frictional forces that actually causes wear and tear in the joint over time. And eventually, as you age, the degeneration will become more intense, and then the bones, instead of, you know, having a cushion that protect them from each other, the cushions and the joint space reduces, and the bone are now in direct contact with each other, and then they will, by nature, have friction, and then that will lead to pain. Okay? Now, I have seen people who have asked me questions about this, their footwear and whatever. A lot of women who wear high heel shoes, especially, okay, I'm not calling names and I'm not mentioning your name, and I'm not sure it's not you, but there's some people who wear these very steep high heel shoes.
Not the platform ones we're talking about.
Yeah, not the flat one, but the very high.
Like maybe like a 4 or 5 inch without any support.
And that put a lot of pressure on your knee. Now, it's okay when you're young because you've got a lot of tensile strength and you are able to go without much stress. But as you grow older and you hit your 40s and your 50s, you may start to pay for those things because that will have caused some degree of damage over time, over the years, into the joint space and the structural joint anatomy, and you may be at risk of osteoarthritis. Okay, so that is one type of arthritis that we all know is very common. It's age-related and it's accelerated by certain types of condition. The other type that we also are familiar with is that is common in ages below 16 years. It's called, juvenile arthritis. Okay, it's a form of autoimmune kind of disease that may be genetically inherited, okay, and affect people who are younger than, you know, the age 16. And this causes a lot of joint destruction where the joint produces, antibodies that damages its cells, you know, and that causes problem. Okay, similar to that also is the third type, which is the rheumatoid arthritis, which may affect people in their 20s and 30s as well. Okay, and sometimes it might be triggered by certain events in your life. I've seen it being triggered even by pregnancy, okay, stress situations and stuff like that. And somebody is just perfectly normal before, and by the time they get pregnant and have a baby around 24, 25, they develop this kind of disease, you know, and affects their joint, and there's a lot of joint deformities that may follow, joint destructions, and it's really very kind of distressing kind of disease, and autoimmune disorder as well. Okay, so that's three types of arthritis that we've learned there. You also have the other type that we call the spondyloarthropathies, which big name, it just mean things that affect the joint and the bony point where muscles and tendons are, you know, attached and stuff like that, and these get diseased, and you know, they create a lot of painful scenario. Okay, symptoms of this may include a lot of pain and stiffness, and that occur especially in the lower back. Okay, the spine is usually affected at most, and though some forms may affect your hand and feet. So you could have those kind of problems. And then you have the one that we call the bursitis and the tendinitis, okay? Because in the joint you do have some sacs in the joint that we call the bursa. When they get inflamed and they get damaged, you could have severe excruciating pain following that.
And the tendinitis
especially athletes who, not necessarily athletes, but people who repetitively use a particular point in their musculoskeletal anatomy that, you know, over the time it becomes a point of wear and tear. You have cricketers, you have tennis players, even the housewife who make roti all the time and always have to be doing things like that, okay, that could happen. I've seen that case in somebody who works in a roti shop, okay, and so these things could happen, and it's a tendon inflammation, okay, that could happen, okay. You could also have some degree of another type of autoimmune disorder called systemic lupus. That also could damage the joint as well. So that could give you a different kind of arthritis
so
as well.
lupus can, because of how it affects the body, it can end up leading
because
arthritis.
it's an autoimmune disorder. It affects the connective tissue disorder. I mean, the connective tissues in your body, and that could also damage the joint as well. Then you could have some as a result of acidic buildup in your body. Notably among this is what we call the gout. When you have a lot of uric acid and stuff like that accumulation in the joint. For example, people who eat a lot of red meat and things that are processed that produces uric acid and those crystals of acid that are accumulating in the joint, you could have some severe problems with that. And the last type that I'd like to discuss about will be the one that we call the infectious arthritis. Okay, in which there are an infection in the body, but the infective agent or the microorganism find themselves in other parts of the body, and they could find themselves into the joint and cause problem. The commonest example is what we call call the gonococcal arthritis. Okay, when people could have gonorrhea, and later in life, you see that the gonorrhea germ will have gone into the joint and caused damage into the joint. And you could have a typical example of what you call an infectious arthritis. There are other microorganisms that could cause that, but I've seen a couple of that
typically
around.
with results then. Yeah. But what does, I know you kind of skimmed over because it's a lot, I mean, a good bit there. But generally, how, if you can explain, what exactly does arthritis feel like to a person? Pain, burning, itching,
depending on what is causing the arthritis. Some of the symptoms might be a little vary from one person to the other, but typically what you have is a lot of joint pain, joint stiffness.
It could be any joint.
It could be any joint, but the bigger joints are mostly affected.
So we're talking about the knees, the elbow,
the shoulder joint. You could have the hip joint and stuff like that. Okay, other joints could be affected too, but these are the major joints.
What about your neck? Okay,
yes, you could have the cervical spine. You could also have the jaw, which is the temporomandibular joint. Okay, that's the jaw. When you open your mouth, that keep moving here, you could have a temporomandibular arthritis. Okay, so that could happen as well. And you have pain, you've got joint stiffness, you've got a restriction of movement as a result of the pain anyway. In some area, you have swelling, you have redness, and the infectious type, you could have, warmth, and evidence of infection. Okay, some could actually become very swollen and have what we call fluid in it, to have what we call joint effusion, in which the joint becomes so swollen and bulging out, and sometimes you might have to actually drain the fluid out using some other surgical technique to get them out. Okay, so it could be as bad as that sometimes.
Does it usually cause any numbness? Can arthritis create any numbness?
Not necessarily. Arthritis does not necessarily have to cause numbness, except there is a nerve involvement. If there are nerve involvement, obviously
maybe a pinched nerve or something.
Nerve, or the degeneration or whatever, the swelling, possibly there is a nerve close to the area and that nerve is affected. So nerve generally, whenever they are under stress or whatever, they get numb, they could burn, they could have a lot of pain pricks, they could have shocking kind of sensations and stuff like that. But numbness is something that has to do with nerve involvement.
Let me ask you this though. Generally, as children growing up and so on, if I see people cracking of your knuckles and your fingers, and people sometimes crack their necks and so on, can that cause arthritis? Can that lead to deterioration, or is that something that people can safely practice still?
That is something that has been debatable for quite a while. Okay, however, there is no scientific evidence that I am aware of that says and concludes that once you crack your knuckles, you're going to get arthritis. However, what we do when we crack our knuckle is that you are forcing the joint to move against a resistance. Okay, and if you continue to do that on a regular basis, what you may eventually incur is a lot of friction that you are causing. Okay, you're letting them move against the force, and the fluid in there, the synovial fluid in the joint, and possibly the air that may be inside there, you cause them to bubble, and that is what causes the popping noise. Over time, if you continue to do that, you may have wear and tear. It's like you're rubbing a solid thing, maybe a metal or a wood or whatever, against another.
So you can have some
over
friction
time, you're
eventually.
going to friction, wear and tear, and eventually degeneration may occur, and that may increase your risk, especially of osteoarthritis. So that could happen.
All right. Well, we're going to take a quick couple seconds break. We gotta get some commercial bits in there. So don't go anywhere, viewers. Stay tuned. We're on a very interesting topic of arthritis, what it is and how it affects us. We'll be right back to On Call.
Jesus, bright as the morning star.
Yes, C.C. Winans will be gracing the beautiful island of Tobago for In His Presence 5, June 4th, 2015 at the new classy Shore Park Complex, together with the dynamic and energetic Uche A.
Where are my praises? Joyous celebration.
In His Presence 5,
Oh, hallelujah.
Tobago. Get ready.
All right, welcome back to today's program of On Call. Thank you so much for staying tuned. As usual, we're with our resident doctor, Dr. Maxwell Adeyemi, and today's topic we're talking about arthritis. And we're not getting into specifics on the different types of arthritis, but just generally looking at arthritis as an inflammation that affects your joints and how it is that it affects us, what are some of the causes, and now we're going to look at diagnosis and treatment of arthritis. So that we've been talking a lot. I mean, you know, we just spoke about how cracking your knuckles and so can, if over a period of time, can lead to bone degeneration, which can, of course, lead to osteoarthritis. But what would you say what would you say people should look for as warning signs that they may have developed or they may be developing arthritis?
Well, the warning signs or the symptoms really basically will include, like I said before, joint pain, joint stiffness, swelling of the joint, maybe restriction of movement, okay, which will come with the stiffness, sometimes redness, swelling around the area. Sometimes some people may feel fatigued or feel tired. Sometimes you could have fever, depending on the type of the arthritis that you're having. Okay, it may involve one joint or multiple joints. Okay, basically those are the symptoms that you start seeing, and you know that, okay, look,
This is
joint,
not a cold.
yeah,
This
joint deformity as well. Okay, you start with the joint become deformed and stuff like that. And then in advanced cases of arthritis, especially rheumatoid arthritis, you have a lot of joint deformities.
Okay, that's
So
where like
they
the
could-
fingers kind of
yeah,
curl
they
up,
can curl up and
they
they
can't
crooked,
move
and they
properly
can't
and-
move, and some of them look funny, you know, that kind of way. You know, so that could happen.
How does, if someone presents with arthritis or, you know, thing they may have, how is it diagnosed? How can you diagnose to know for sure that this is arthritis and not as a reference to my great grandma, not just a cold that you develop because of how you were dealing with some stuff, but it really is arthritis?
Well, based on the history that you're given in terms of what is happening, okay, the doctor takes a history from you, okay, what are the symptoms you're having, he examines you and then look for some of the signs that you expect when you have arthritis and stuff like that. And in some instances, you may possibly need to do some blood tests, okay, because there's some types of arthritis that we can diagnose by blood tests, like the rheumatoid arthritis and other types of causes of arthritis, like SLE and the other things. You can do some blood tests, okay, there's some genetic testing that you can also do. Okay, and then when you do that test, then you can also do some imaging techniques like X-rays, CT scan, or MRI. I mean, those are, you know, advanced studies, but they can also give you a clear idea of what is going on in the joint, and you'll be able to see, okay, is it inflammatory, is it degeneration, okay, and you'll be able to say, okay, well, this is what is happening.
Okay. Is there, I know we have doctors that specialize in all types of fields, and we have the chiropractor who people especially go to when they figure they need to get, you know, a nice stretch out. And so is there a specific doctor specialist for arthritis? So I should not go to my general practitioner, or, you know, maybe not the gynecologist. Is there a specific doctor who can diagnose arthritis?
Generally, your general practitioner, your family physician should be able to treat the arthritis and make a diagnosis of the arthritis and say, okay, well, look, this is what is happening. However, in some specialized cases, you know, you may need to see neurologists for certain kind of condition. You may also need to see an orthopedic person, okay, especially if certain kind of diagnosis tests need to be done, okay, because sometimes you may need to do invasive technique that will look into the joint, what you call something like an arthroscopy, in which they use a special tool to go into the joint, and they can actually project that onto a camera. You can see real life what is happening in the joint in terms of if there's degeneration or inflammation or tear or whatever it is that you can see. Okay, so you may need some of those specialized tests. Okay, there's some other type of supportive staff, medical support staff that may also help, not only in diagnosis but also in the treatment of arthritis. Okay, so you might need the physical therapist, the physiotherapist and stuff, the physicists and stuff like that. A lot of them will help you, you know, occupational therapy, rehabilitation, and, you know, so many other things. Sometimes even you might need the nutritionist to advise you on the diet, especially those with gout and other kind of, you know, diet-related conditions, you know. Yeah.
Well, you started talking about my next question before I asked in terms of treatment.
All right.
Right. So you jumped a little bit into treatment. So now I'm asking the treatment question. So you can give me some. What are the options for treatment for arthritis, for dealing with arthritis?
Okay. Depending on the cause of the arthritis, the treatment may vary from one type to the other, and your treatment choice or options will be dependent on the type that you have. However, there's a common denominator. Patients with arthritis are in pain, and therefore most important in the treatment will be pain relief. So pain management with different types of pain relief or analgesics, as we call them, okay, and different person may be able to tolerate different types of, you know, pain relief, and also depending on the severity of the pain that they have will determine how strong a painkiller you may need, and also depending on the medical condition and other conditions that they may have, certain pain tablet may be needed and you may not be able to take certain types. Okay, because there's some you may not be able to take if you have kidney problems and stuff like that. If you have allergies, you may not be able to take certain type of things, you know. If you have other kind of medical illness that may warrant you not taking this particular kind of medication, the doctor will have to make a decision. But most importantly, pain relief, and we have tons of pain relief. Okay, and some other type, you may also need some anti-inflammatory like steroid, prednisolone or hydrocortisone or stuff like that. Some people actually take it orally and some inject into the joint. I'm not into the fan of those steroid injection into the joint. Some people do it. It works, you know. But
that is a way of relieving the pressure that's there, because
process. Okay, because the steroids are anti-inflammatory in nature, and that's one of the functions. They reduce inflammatory process. So, you know, you may be able to reduce the inflammation, the swelling goes down, and then they're able to move freer. Okay, so that is pain relief. then you may now have to deal with other problems in terms of physical rehabilitation. So you might need a physiotherapist to come in. You may need an occupational therapist to come in. You may need a dietitian or nutritionist to come in and advise and stuff like that. And if the arthritis is being caused by other problems, okay, like the SLE and systemic and stuff like that, you may need to get that treated. Now, if it is caused by infection, you may need some antibiotic or whatever is causing it to treat that microorganism so that you can control what is going on.
I wanted to ask about what as individuals people can do to manage arthritis. But before I ask that, is there anything that is there anything that people can do to prevent arthritis? So I asked that. I remember looking at this commercial just the other day, just saying, some things people want to believe that I can take this and I can do that. Maybe eating Brussels sprouts, or if I exercise, or if I have, I don't know, whatever. There's something I can do so that I can run away from being affected by this. Is there anything that people can do to avoid getting arthritis?
Okay. The arthritis that as a result of genetic problems, there may be very little that you can do about that.
So we can do like Angelina Jolie and get you some gene pull out.
Well, what Angelina Jolie did was that she did a genetic testing that says, okay, look, you have this gene increases your risk of breast cancer and ovarian cancer. So preemptive action strike, or whatever they call it, preemptive strike, take them out. Okay, now how many of your joints are you going to take out? Okay, so that does not sound practical.
Right, and then of course we don't always have, we don't have Angelina Jolie's money. So.
Right, so if you have those kind of genetic things, you may be able to reduce your risk, but you may not be able to completely eliminate the problem. Now, the ones that are caused by aging, degeneration of bone too, there's very little we can do about our aging process. Every day you wake up, you are older. Okay, now what you can do to limit that is what you do that may increase your wear and tear is, like I say, people who crack in their whatever, you may possibly think twice about that. People who wear very high heel shoes, you may have a rethink about the height of the shoe that you're wearing. I mean, it looks nice and fashionable, but it may not necessarily be healthy in the long run. Your diet is something that you can do something about as well, okay? Because if you eat a lot of acidic stuff that, meat and things that increase acid in your body, which may eventually be deposited in your joints, that may increase your risk. So you may need to examine those kind of diet as well, okay? And just live healthy.
Right. That is a very good summation. I mean, we can't run away from it.
You look very lost in thought, like you're internalizing.
I was just thinking about my shoes.
Yeah, because you wear a lot of high heel shoes.
Yes,
and you're now reluctant that you have to take them and throw them away.
And I'm thinking about some of my foods that I like to eat, and I'm thinking, yes, and then the fact that, we really can't.
I could see the morbid fear in your face. You look very
I was just thinking, as you spoke, I was just thinking,
Okay, well, let us think.
As the word of God says in Joshua 1:8, you need to take the word of God and write it in your heart. So as you take the advice from the doctor, you need to, you also need to internalize it.
So next time I see you with a
well, I can't promise that. But you see, you see, the compromise for me is the platform. Okay. So while I wouldn't do a steep, I mean I have few, but while I wouldn't do the steep, I would kind of bring a cushion to, kind of support the joints.
No problem.
Right. So
that's a good compromise.
Well, thank you so very much for your time, Dr. Max. And viewers, thank you so much for tuning in to today's program of On Call. I really hope that you got some information today. Even if it's not for yourself, you can pass it on to those around you, those in your family, those in your immediate friend circle, so we can help each other to have a better and a more holistic life. Thank you all for joining us for today's program of One Call. See you again next week, same time, same place. Have a great day.